Hello everyone, welcome back to the channel. Today we are diving into an exciting topic in pharmacokinetics, that is compartmental modeling in pharmacokinetics. This is a crucial concept that helps us understand how drugs move through our bodies. So let's get started. First we'll talk about what compartment modeling is. Imagine your body as a series of interconnected compartments, like rooms in a house. Each compartment or each room represent a group of tissues or organs that have similar blood flow and affinity for the drug. This model simplifies the complex process of absorption, distribution, metabolism, and excretion into a manageable mathematical equations, and it simplifies complex biological process into linear and non-linear models. Now linear means proportional relationship between dose and concentration, while non-linear is non-proportional relationship. It is often due to saturation effects. In linear, the graph will be straight line and equation will be linear, while in non-linear, the graph will be curved and equation will be non-linear. Now there are three main types of compartment models: one compartment, two compartment, multi-compartment. One compartment, this is the simplest and most commonly used for quick estimations. Then two compartment model is used for drugs that have distinct distribution phases. Then we have multiple compartment or multi-compartment model. This is rarely used in clinical settings due to its complexity. Now, each compartment model serves a different purpose based on how the drug behaves in the body. Now, let's look at some key assumptions of these models. The body behaves as a system of interconnected compartments. Then the drug movement typically follows first order kinetics. That means the rate of elimination is proportional to the drug concentration. Then each compartment is well stirred and homogeneous, which means the drug is evenly distributed within that compartment. Let's break down the one compartment model, starting with IV bolus administration. Here the drug is injected directly into the bloodstream. So there is no absorption phase, only elimination takes place. Here is the model. You can see drug is in the form of IV bolus is injected into the central compartment. There is no absorption because it is directly injected, and it is elimination from the central compartment takes place. Now we have the equations. These equations you have to remember in the exam. The equation we use here is Ct equals to C naught multiplied with e power minus kt, where Ct is equals to plasma concentration at time t, then C naught is the initial concentration, K is the elimination rate constant, T is equals to time. This equation shows us how the concentration decreases exponentially over time. Next we have volume of distribution and half-life. The volume of distribution is equals to dose divided by C naught. This tells us how extensively the drug is distributed in the body, and the half-life is calculated as T half is equals to 0.693 divided by K. This is the time it takes for a drug concentration to reduce by half. The concentration of drug is reduced by half. Now let's discuss IV infusion. Here the drug is administered at a constant rate and the plasma concentration increases until it reaches steady state concentration. You can see in the diagram drug is in the form of infusion that R naught represents rate of infusion is directly injected into the central compartment at a constant rate. Then the elimination takes place. The equation during infusion is Ct equals to R naught divided by Vd into K and 1 minus e power minus Ket. Then at steady state concentration, the equation will be represented as CSS. Steady state concentration equals to R naught divided by Vd into K. So this tells us the concentration we can expect when the drug is administered continuously. And after stopping the infusion, concentration decreases as Ct equals to CSS into e power minus Kt. This shows how the drug concentration will decline over time, where R naught equals to rate of infusion, Vd equals to volume of distribution, K is the elimination rate constant. Next we have the oral administration equations, and which includes an absorption phase, and the drug passes through the gastrointestinal tract before entering systemic circulation. So the equation will be Ct equals to Fd and Ka divided by Vd Ka minus K. Then it is multiplied by e power minus Kt minus e power minus Kat, where F equals to bioavailability, D equals to dose, K is the absorption rate constant, K is the elimination rate constant. Now the peak concentration occurs at time Tmax. So Tmax will be integration of Ka minus integration of K whole divided by Ka minus K. This is the diagrammatic representation of oral administration. So we are injecting drug, then drug goes in the GI tract and absorption takes place. Then it reaches central compartment. Then elimination takes place. Now this Tmax tells when the drug reaches maximum plasma levels in the body. Now designing dosage regimens is about keeping the drug levels between therapeutic and toxic limits. So loading dose is it is used to quickly achieve the target drug concentration or therapeutic concentration, and the formula includes loading dose equals to concentration target into Vd. Then the maintenance dose is to maintain steady state plasma concentration during repeated dosing. This formula includes maintenance dose equals to steady state concentration multiplied by Cl in, and tau, where Cl is the clearance and the tau is the dosing interval. So dosing interval tau the represent is based on drug half-life to avoid fluctuations outside the therapeutic window. Concentration is typically achieved after 3 to 5 half-lives to achieve steady state concentration. So applications include to estimate pharmacokinetic parameters, to design individualized dosage regimen, to predict plasma concentration levels, and to assess the bioavailability and bioequivalence of drugs. To conclude, Compartmental model simplifies drug kinetics and guide clinical decisions. Understanding these models helps the pharmacist and healthcare professionals optimize therapy and individualize treatment safely and effectively. So if you found this explanation helpful, please like and subscribe. Thanks for watching this video.